Let's bring in Ziv Cohen for more on this. He's the director at Principium Psychiatry. Dr. Cohen, good to have you with us. So during this trial, we heard a psychiatrist testify about Heard's PTSD from alleged abuse. You specialize in PTSD and psychological trauma. How do those symptoms manifest, and are you seeing any of those play out on the stand at all?
Sure. PTSD is something that happens commonly in abuse. And, what we're seeing here is, of course, Amber Heard is making allegations that she, has been damaged psychologically, that she has PTSD. Johnny Depp did not put his mental health at issue in this trial, so he's not making that direct allegation. But of course, he's alleging that he was in fact abused by her. So she's testified to her emotional damages. She's brought a psychologist, and they're really arguing that she has the symptoms of PTSD, that she has intrusive thoughts. She's avoiding things that trigger memories of the abuse. That she has had, mood symptoms that go along with this, feeling down because of the abuse. So that's really the allegations that she's making here.
We've already heard testimony from Johnny Depp about alleged abuse from Heard. A lot of people are wondering and asking who are watching this, is it possible both parties both experienced some type of abuse? How do we make sense of both their testimony?
Absolutely. So it can be really hard to disentangle abuse in a relationship. There's often, as relationships spiral out of control, there can be abuse that's going both ways. So I think it's going to be very hard for the jury here to make sense of that. This is a civil trial, so the jury only has to decide that it's, a little bit more likely that one or the other side is telling the truth to actually come down with a verdict. But I think it's going to be very hard. It's hard to predict what they're going to decide because we're hearing from both sides a lot of examples of inappropriate behavior, abusive behavior from both sides. They're going to have to decide who was primarily to blame. Heard is making the argument that he was the male, he was stronger, he was older, more powerful, and that he was really setting the pace of the abuse. But he's arguing that she was emotionally unstable and that she would really corner him and that she was abusive towards him. So it's a really hard one to disentangle.
Outside of the courtroom, for people who are watching or just can't avoid the news, can't avoid these headlines, how do you avoid being triggered by seeing these headlines, especially if someone is suffering from some type of trauma or PTSD themselves?
Well, my patients with PTSD, one of the things we talk about is how to avoid being triggered. The news can be a huge trigger for people with PTSD, either because something directly related to your trauma is suddenly in the news or just other bad things are in the news all the time, especially lately, and that can be triggering. So we talk about limiting your news consumption. We talk about using mediums of news that are less triggering. For example, if holding a newspaper is less triggering for you than going to a website where there's going to be flashy headlines that are going to pop on your screen. Going to news sites that you respect that are going to be a little bit toned down, a little bit more responsible, not sensationalizing. And trying to avoid social media. Lots of news, quote unquote, that gets fed through on social media is the most sensational, most upsetting news.
Dr. Ziv Cohen, thanks so much for joining us this morning and helping us analyze this. We really, really do appreciate it. And to our viewers, if you or anyone you know is struggling, you can call the National Suicide Prevention Lifeline at 800-273-8255, or you can text the word TALK to 741-741.